Hello to everyone. This is Durga Devi from E.S College of Nursing. Today I am going to discuss the topic of quality of nursing professional. So, every nurse need a quality to provide a good care, and the quality is rapidly become concern to both the consumers and the providers of the service. In healthcare, quality is being demanded and expected, and providers are judged by the quality of services. There is a need to sensitize and train our nursing professionals and personnels to provide the quality care. So every nurse should need the quality to provide best care to the patients who need this service. And there are the some more basic qualities of your nursing, and in that the particularly first one is caring. Now most people assumes that all the nurses enter the field because the caring is one of their leading quality. A nurse showing their natural tendency to truly care about how their patient feels. So caring is one of the most important first quality of a nurse. Next thing is a communication skill. A strong communication that bind and mingle with the people who are need the care. And the strong communication are a critical characteristics of a nurse. A nurse role relies on the ability to effectively communicate with other nurse, physician, disciplines across their unit, patients and their families. And third one is empathy. So empathy is a characteristics of a good nurse is one that show empathy to each patient, making a true effort to put themselves in their patient's life. By practicing empathy, nurses are more likely to treat their patients as a people and focus on the person centered care approach. So empathy is another most important characteristics and the quality of a nurse to provide best in their nature. And then is attention to the details. Whatever they says by the patients, you have to listen to it, and whatever you says, what you are saying, the patients also should focus on their attention to your content. So a nurse are undoubtedly under immense pressure as they balance receiving orders from physician with using their own knowledge, skill and critical judgment to provide the highest quality patient care. Another most important thing is a problem solving skill. While a clinical knowledge and training is a thought that a nurse education on a job, training is the most effective way to help shape a nurse problem solving skill. So problem solving skills are essential to nursing, as a nurse generally have the most one-to-one time with the patients and are often responsible much of the decision making. So in a critical situations or in any emergency situation, the nurse has to make a quick decisions and they have to solve out the problems what comes in that particular situations. Another thing is the stamina. Every nurse need a much more stamina to build up and provide best care to the patient. The physically demanded on the nurses perhaps one of the most underestimated aspects of their careers. Every nurse need a physical and emotional stamina. Having a sufficient stamina is one of the best important quality of the great nurse. Stamina is most important. Why they are saying means when we are having a sufficient stamina, then only we can provide the sufficient care to the patient who needs an emergency and care to the at that particular situations. Next is a sense of humor. You have to make a sense of humor with the patients who are in a depressed and anxiety mood to drive the satisfaction from such a mentality and a physically exhausting career. Nurse that can find a time of laugh are typically more successful in their roles. Having a good of humor also helps spread positivity to others nurses, the patients and their families. See, a nurse have the another quality of sense of humor to spread positivity to the other people, then they make a good health. Another thing is commitment to the patient advocacy. As one of the leading quality of the nurse, a leader, great nurse understand that patient advocacy is a mindset that must be practiced every day with every patient, and the willingness to learn. So you have to have willingness to listen the content of the patient, then only you have to provide the sufficient care to the patient. Nurse spend more bedside time with the patient than any other role in healthcare, and their willingness to learn and put their knowledge into practice is one of their leading traits of the good nurse. So the nurse should spend time with your colleagues and also the patient to learn what they are saying, and what they are trying to do better thing in the healthcare system. And then is the critical thinking. The most important thing is a critical thinking in a critical situations and in the emergency situations. It provides and it shows the good qualities of your nurse. After the years of education and training, the ability to apply the clinical guidelines and the best practice on the floor depends on their nurse ability to think critically, which is quickly noticed by leadership, other nurses, and ultimately patients. So every nurse need a critical thinking, a nurse ability to think critically in any situations to build much more effects for the patient health. Another thing is a time management. So nowadays the nurses are not having a sufficient time to make a perfect thing in a perfect time, because providing services in a different manner, having the ability to implement effective time management is a key personality trait for nursing, as in a being able to concentrate on the most critical issues first, which is not necessarily the patients and the family that demanding the most. So every nurse have the ability to manage the time for themselves and also providing care to the patients. Another thing is a leadership. A good leadership leads to the good quality that shows how you are in a good leadership. A quality of a good nurse that will become more and more valuable in the growing nursing field is the ability to successfully lead. The mentorship from the nursing leader can also teach invaluable lessons on how to become the great nurse. So every nurse should learn the leadership, and you have to be a leader in the team to make a teamwork in a perfectful manner. Another thing is experience. So we have a lot of experience in our lifetime through the giving the care to the patients in our nursing field. By engaging with the new nurses to install an expectations of continuous learning while creating a positive environment for them to learn from experienced nurse. A nursing leader will set a new nurses up for the success benefiting their careers, the organization, the most importantly their patients. So thank you. So these are the factors we are discussed and the qualities of nurses needed in the further future care which is given by the nurses. Thank you.